Hey guys, welcome back to the channel. Today I want to talk about something that's honestly had a lot of the veterinary community and a lot of dog owners pretty concerned over the past couple of years, and it's still an evolving story right now. It's called atypical canine infectious respiratory disease, sometimes shortened to a SHIRD, or you might also see it referred to as canine respiratory disease of unknown origin. And I want to be upfront with you from the very start of this video. This is a bit of a different topic for me to cover, because unlike most of the diseases I talk about on this channel, this one is still not fully understood, even by veterinary researchers and public health experts. So in this video, I want to walk you through what we do know so far, what makes this different from regular kennel cough, what symptoms to watch for, and most importantly, what you can actually do to protect your dog while investigations are still ongoing. Let's get into it. So let's start with a bit of background on how this all came to light. Back in the summer of 2023, veterinarians in Oregon started noticing something unusual, a cluster of dogs coming in with a respiratory illness that looked similar to kennel cough on the surface, but behaved quite differently. Around 200 cases were reported in that initial cluster around Portland. And what really caught everyone's attention was that these dogs were testing negative for all the usual suspects, the common viruses and bacteria that normally cause kennel cough, things like Bordetella, parainfluenza, and canine adenovirus. Something else seemed to be going on. From there, similar reports started coming in from veterinarians across other states. And pretty soon this wasn't just an Oregon story anymore. Cases were being reported and investigated across close to 20 different states in the US, with a noticeable concentration on the West Coast, though certainly not limited to that region. Public health departments in various counties, including a well-documented investigation out of Los Angeles County, started actively tracking and case finding to understand just how widespread this was becoming. So what actually makes this different from regular kennel cough, the condition I covered in a previous video on this channel? This is really the key question, and it's what makes this particular illness so much more concerning to veterinary professionals. With classic kennel cough, we can usually identify the specific virus or bacteria responsible through routine respiratory PCR testing, and the vast majority of cases are mild and self-resolving within 1 to 3 weeks, with the dog remaining otherwise bright and eating normally throughout. Atypical canine respiratory disease breaks that pattern in a few really important ways. First, and this is honestly the most striking difference, dogs with this illness test negative on the standard respiratory panel that screens for all the usual well-known pathogens. So when a vet runs the typical panel of tests looking for Bordetella, parainfluenza, canine influenza, adenovirus, and the other common culprits, and everything comes back negative, but the dog is still clearly sick with a respiratory illness, that's when this atypical classification starts to come into the picture. Second, the duration of illness tends to be considerably longer than what we'd expect from typical kennel cough. Where a normal case usually clears up within a couple of weeks, dogs with this atypical illness have been reported to cough persistently for 6 to 8 weeks in many cases, sometimes even longer, which is a really unusual and prolonged course for what starts out looking like a fairly standard respiratory infection. Third, and this is the part that understandably worries owners and vets alike, a subset of these cases can progress much more rapidly and severely than typical kennel cough ever would. Some dogs have been reported to deteriorate quite quickly, in some documented cases within as little as 24 hours, progressing from what looked like a fairly mild respiratory illness into severe pneumonia. And in a small number of the most serious cases, this illness has unfortunately been linked to fatal outcomes, which is something we essentially don't see with typical uncomplicated kennel cough in an otherwise healthy dog. Now, I want to be really careful here, because I don't want this video to come across as fear-mongering, and I think it's really important to keep this in proper perspective. The reported case numbers, even across multiple states, still represent a very small percentage of the overall dog population, and the majority of dogs who do become unwell with this illness, based on what's been reported so far, do recover, even if it takes longer than a typical case of kennel cough would. But because there have been some severe and even fatal cases reported, and because we don't yet fully understand what's causing it, it's absolutely something worth being aware of and taking sensible precautions around, which is exactly what we're going to talk about today. So let's talk about the actual cause, because I know this is probably the question on a lot of your minds. What exactly is causing this illness? And I have to be honest with you, as of right now, there isn't one single universally confirmed answer. This has genuinely been one of the trickier disease investigations in recent veterinary history. precisely because standard diagnostic testing keeps coming back negative for the usual suspects, which means researchers have had to dig much deeper to try and identify what might actually be responsible. There have been a few significant leads along the way, though. Researchers at the University of New Hampshire's Veterinary Diagnostic Laboratory, working alongside their Genome Sciences Center, identified a potential novel bacterium in a notable percentage of the samples they tested from affected dogs. This bacterium was described as difficult to culture using standard laboratory methods, which is part of why it hadn't been picked up by routine testing before. And it was noted to have some similarities to a type of bacterial pathogen associated with a respiratory illness that had previously been described in humans. I do want to stress, and this has been emphasized clearly by the researchers involved, that these findings were described as preliminary at the time, and importantly, there's been no evidence found to suggest this particular pathogen spreads from dogs to people. Investigations into confirming and fully understanding the role of this specific organism have continued since then. Beyond that specific lead, the broader consensus among veterinary researchers is that this illness likely falls under the wider umbrella of what's called canine infectious respiratory disease complex, meaning it's probably not necessarily one single new pathogen acting alone, but could involve some combination of a novel or under-recognized organism potentially interacting with other more familiar respiratory pathogens, environmental factors, or host susceptibility factors, all contributing to why some cases present and progress so differently from typical kennel cough. Some researchers and veterinary organizations have also pointed out contributing factors on the broader population level that might help explain why we've seen an apparent rise in canine respiratory illness in general in recent years. Things like increased dog ownership numbers, shifts in vaccination rates during and after the pandemic period, increased dog socialization as things like boarding, daycare, and dog parks became busier again, and the growing popularity of flat-faced brachycephalic breeds who are already inherently more vulnerable to respiratory complications due to their airway anatomy. So where does the investigation stand right now, going into this current period we're in? Honestly, this remains an active area of ongoing research and surveillance. Public health and veterinary authorities in various states continue to monitor case reports, and diagnostic laboratories continue working to better characterize whatever pathogen or combination of factors is ultimately responsible. This is genuinely one of those situations in veterinary medicine where the science is still catching up to the clinical reality on the ground, and I think it's important for me to be honest with you about that uncertainty, rather than pretend we have all the answers, because we simply don't yet. Now let's talk about symptoms, because this is really the practical information you need as a dog owner. What should you actually be watching for? The initial presentation of this illness can look quite similar to typical kennel cough, which is honestly part of what makes it tricky to distinguish early on without proper veterinary testing. Common signs reported include a persistent cough, which can be dry and hacking similar to classic kennel cough, sneezing, nasal discharge, watery or discharging eyes, and in more affected dogs, fever and lethargy. Where things start to look different, and where I really want you to pay close attention, is in a few key areas. The cough tends to be more persistent and drawn out than what you'd typically expect, often continuing for many weeks rather than resolving within the usual 1 to 3 week window we'd see with standard kennel cough. Some dogs also show a noticeable loss of appetite and more pronounced lethargy compared to typical kennel cough cases, where dogs, as I mentioned in my other video on this topic, usually remain remarkably bright and interested in food despite the cough. The really critical warning sign to watch for is difficulty breathing. This could look like rapid breathing, labored or effortful breathing, breathing with the mouth open when your dog wouldn't normally do that, or any indication that your dog seems to be working harder than normal just to get air in and out. This is a sign that the illness may be progressing towards pneumonia, and given how quickly some of these reported cases have deteriorated, sometimes within as little as a day, this really isn't a wait-and-see situation. If you notice your dog struggling to breathe, this needs immediate veterinary attention, ideally an emergency vet visit if it's outside of normal clinic hours. I also want to mention that because this illness currently doesn't have one single confirmed test that definitively diagnoses it, the way vets are generally approaching a suspected case is somewhat by exclusion, meaning your vet will likely run the standard respiratory panel to test for and rule out the usual, well-known causes of kennel cough. And if your dog's symptoms are unusually persistent, severe, or slow to resolve despite testing negative for those common pathogens, that pattern itself becomes part of what raises suspicion for this atypical presentation. So now let's talk about what you should actually do if you're worried your dog might be showing signs of this illness, or if you just want to be proactive about protecting them given everything we've talked about so far. First and most importantly, if your dog develops any respiratory symptoms at all, coughing, sneezing, nasal or eye discharge, reduced appetite, or lethargy, please don't just assume it's a mild case of kennel cough and wait it out on your own, especially given everything we've discussed today. Contact your vet, describe the symptoms clearly, and let them guide you on whether your dog needs to be seen and how urgently. Most vet clinics have specific protocols now for managing suspected respiratory cases, often including things like using a separate entrance or waiting outside rather than in a shared waiting room, specifically to help prevent any potential spread to other dogs at the clinic while your dog is being assessed. If your dog is diagnosed with a respiratory illness, whether it turns out to be typical kennel cough or something that looks more atypical, please follow your vet's guidance closely regarding isolation from other dogs. Given that this is similar to how typical kennel cough spreads through respiratory droplets and close contact, keeping an affected dog away from other dogs until your vet has confirmed they're fully recovered is really important, both for your own dog's recovery and to help limit any further spread within the local dog population. I really can't emphasize enough how important it is to seek prompt veterinary care if you notice any signs of breathing difficulty, significant lethargy, or if your dog just seems noticeably unwell beyond a simple cough. Given the reports of rapid deterioration in some cases, catching things early and getting your dog properly assessed and, if needed, treated really does make a meaningful difference in outcomes. Now, when it comes to treatment, because we don't have one single confirmed causative pathogen identified yet, there isn't a specific targeted treatment or vaccine designed against this particular illness the way we have, for example, a Bordetella vaccine for classic kennel cough. Management is generally supportive, similar in principle to how we manage typical kennel cough, but with much closer monitoring given the potential for more rapid progression. This can include supportive care to help keep your dog comfortable, oxygen support and hospitalization if a dog is struggling to breathe or has developed pneumonia, and antibiotics if your vet suspects or confirms a secondary bacterial component, even though the underlying cause of the initial illness itself may not be a standard bacterial pathogen that antibiotics would directly target. Let's talk about prevention now, because even though we don't have a specific vaccine for this particular illness, given the uncertainty around its exact cause, there's still a lot of overlap with general good practice around reducing your dog's exposure to any kind of respiratory illness. And these precautions become even more valuable while this particular condition is still being investigated. Keeping your dog's vaccinations current, including the standard kennel cough vaccine covering Bordetella and parainfluenza, remains a sensible baseline, because even though it may not specifically prevent this atypical illness if it does turn out to be caused by a different novel pathogen, it still helps protect against the more common causes of respiratory illness that your dog is statistically much more likely to encounter, and reduces the overall burden of respiratory pathogens your dog's immune system might be dealing with at any given time. Being thoughtful about high exposure environments is really important right now. This means being a bit more cautious around busy boarding facilities, doggy daycares, dog parks, and group training classes, particularly in areas where cases of this atypical illness have been reported. I'm not saying you need to completely avoid socializing your dog or stop using these facilities altogether, but it's worth doing a bit of due diligence. Ask facilities about their illness reporting and isolation policies, and if you hear that there's been an increase in respiratory illness cases locally, it might be sensible to temporarily scale back on high-contact group activities until things settle down. If your dog is showing any signs of respiratory illness, please keep them away from other dogs, including avoiding dog parks, daycare, boarding, grooming appointments, and group walks until your vet has confirmed they're no longer contagious and fully recovered. This really is one of the most important things you can do, both to protect your own dog from potential complications by allowing them proper rest and recovery, and to help limit any further spread to other dogs in your community. Keeping an eye on local and regional reports about respiratory illness trends in dogs can also be genuinely useful. Various state veterinary associations, university veterinary colleges, and local public health departments have been providing updates as investigations continue, and staying a little bit informed about what's happening in your specific area can help you make more informed decisions about your dog's socialization and risk level. Supporting your dog's general immune health through good nutrition, appropriate exercise, maintaining a healthy body weight, and minimizing unnecessary stress is always valuable too, even though it's not a specific targeted prevention method against this illness, because a generally healthy immune system gives your dog the best possible foundation for fighting off any kind of infection they might encounter. I also want to briefly touch on the question of whether this poses any risk to humans or other pets in the household. because I know this is something that naturally crosses owners' minds whenever a new or poorly understood illness comes up. Based on what's currently been reported and investigated, there is no evidence to suggest this illness spreads from dogs to people. Researchers investigating the potential novel bacterium I mentioned earlier specifically noted no evidence of that kind of transmission to humans. That said, given that this is still an evolving situation with an unconfirmed cause, continued research and surveillance is ongoing, and it's always sensible to practice good general hygiene, like washing your hands after handling a sick dog, just as a matter of routine good practice. I do want to spend a little bit of time addressing why this particular illness has been so difficult to pin down, because I think it actually says something interesting about the broader state of veterinary disease surveillance compared to human medicine. When new respiratory illnesses emerge in the human population, there's an enormous, well-funded, globally coordinated infrastructure for surveillance, genetic sequencing, and rapid public health response. Veterinary disease surveillance, while it absolutely exists and has some really dedicated researchers and institutions working on it, generally operates with considerably fewer resources and less standardized nationwide coordination. This isn't a criticism of the people working on these investigations, who have been doing genuinely excellent, careful work under real constraints. It's more just an honest acknowledgement of why identifying and fully characterizing something like this can take longer than we might hope, and why the picture is still evolving rather than fully settled. I think it's also worth mentioning that this pattern, a new or poorly understood respiratory illness emerging, causing concern, and taking time for the scientific and veterinary community to fully characterize, isn't actually unprecedented in veterinary history. We've seen somewhat similar situations play out before with other emerging pathogens in companion animals, where it took time, sometimes years, of careful investigation before a definitive causative agent was confirmed and appropriate targeted prevention strategies, like specific vaccines, could be developed. So while the uncertainty here is understandably a little unsettling, it's part of a process that historically does tend to move towards clearer answers over time, even if that timeline can feel frustratingly slow when it's your own dog's health you're concerned about. Now, I want to bring this back to something practical and reassuring, because I don't want you walking away from this video feeling like every cough your dog has is now something to panic about. The reality is, the overwhelming majority of coughs and respiratory symptoms in dogs are still going to be either typical, run-of-the-mill kennel cough, which resolves uneventfully with some basic supportive care, as I covered in my other video, or one of the many other common, well-understood causes of coughing in dogs, like a collapsing trachea, mild allergies, or something similarly benign and manageable. This atypical illness we've been discussing today, while genuinely important to be aware of, still represents a relatively small proportion of overall canine respiratory cases. What I really want you to take away from this video is this: pay attention to your dog's respiratory symptoms. Don't just assume everything will resolve on its own, especially if the cough is unusually persistent. If your dog seems more lethargic or off their food than you'd expect with a simple cough, or if you notice any signs of labored breathing, get them properly assessed by your vet promptly. Follow isolation guidance if your dog does test positive or is suspected of having a respiratory illness, and stay a little bit informed about what's happening in your local area regarding any reported increases in respiratory illness among dogs. Beyond that, keep up with routine preventive care, be a little more thoughtful about high-exposure environments during periods of increased local concern, and trust your vet to guide you through the appropriate testing and treatment path if your dog does become unwell. I also want to acknowledge, because I think it's important to be transparent with you, that because this is an evolving situation, some of the specific details I've shared today, particularly around the exact cause and any emerging research findings, may continue to be updated and refined as investigations progress. I'd really encourage you to keep an eye on updates from your own local veterinary associations, university veterinary schools, and public health departments, as they're often the best and most current source of region-specific information as this story continues to develop. Alright guys, that wraps up today's video on atypical canine infectious respiratory disease. I know this was a bit of a different kind of topic for the channel, dealing with something that's still genuinely uncertain and evolving rather than a condition we have fully figured out. But I think it's exactly these kinds of topics that are the most important to talk about honestly, rather than either ignoring them or overstating how much we know. If you found this helpful, please give it a thumbs up, subscribe to the channel if you haven't already, and let me know in the comments if you've heard about cases of this in your own area, or if you've got questions about respiratory health in dogs more generally that you'd like me to cover in a future video. As always, I read through every single comment, and it genuinely shapes a lot of what I decide to cover next. Thanks so much for watching. Keep a close eye on your dogs, and I'll see you in the next one.